A national survey has found that young Australians are delaying dental treatment due to the cost and some performing their own DIY dentistry. The Australian Dental Association survey has found that 60% of adults under the age of 25 are being encouraged by social media to have cosmetic dental procedures. Dr. Monica Farrelly is from the Australian Dental Association and joins us now from Sydney. Dr. Farrelly, thanks for joining us. I wonder how surprised you are by these findings. Some 25,000 respondents. Given we've got a cost of living crisis, there's vast availability of therapies that you can kind of access from home, just go to your local pharmacy, and the sheer cost of seeking dental care. Are you surprised by these findings?
Good morning. Thank you for having me on today. We are not surprised at the Australian Dental Association by these findings. We know that young people aged 18 to 25 are really experiencing a cost of living crisis, increasing rent pressures, busy schedules with work and study, and often dentistry really falls off the bandwagon and they only attend when issues are urgent or painful.
One of the things that this survey turns up is this idea of DIY dentistry. Tell us how that manifests itself, how that comes about.
Most definitely, very common. In practice, a lot of patients will ask me about alternative therapies. There's a lot of pressure on young people now on social media to have perfectly straight white teeth, and often social media portrays cosmetic dentistry as a quick healthcare fix. That's not the case. There are actually risks and complications with doing DIY treatment. So we always encourage young people and any Australians to go seek clarity with their dentist and have a professional consult, because often social media doesn't actually show the full extent of the picture.
When you talk about risk, though, are we talking about things that are readily available over the counter as well?
Most definitely. There is a range of over-the-counter materials, so you can pick up something from your pharmacist that focuses on teeth whitening, for example. A lot of those products actually are not as high percentage as what can be prescribed by your dentist, but a more concerning issue is that they're not customised to the patient. So there's risk of causing sensitivity to teeth, burn on the gums, or, whitening areas that are actually cavities or decay. So a lot of people are choosing to have cosmetic fixes where the underlying health issue is not actually being addressed.
What role does social media play here? I mean, there are a lot of, try to resist the term influencer, but there are people who are very qualified dental health professionals who do go on social media, make these videos. Is it bad to use social media as your first entry point to considering what sort of therapy you might seek?
I think we would be silly to think that readily available information on social media is not apparent. That's where a lot of young people seek information. So this campaign is actually trying to meet them with that gap. There's no issue in seeking more information about your healthcare, but we just want to make sure that it's actually accurate information. So a lot of individuals who are not dentally qualified may be showing a snippet of their procedures, whether it be cosmetic or whether it be something that is actually not even in the realm of dentistry. What we actually want to encourage young Australians is to go have those conversations with their dentists. They can have the information that they may have generated from social media, influencers, AI, but dentists are still the professional experts who have the training and qualifications to talk about the different treatment options.
But where it's too expensive and not covered by Medicare, we'll get to that in a moment, but where it's too expensive, what is the next best option for someone?
The first option would be having the consult. A lot of the time, that's not actually the expense. It's more the treatment that may be considered more expensive. There is also, government services that are available for those who are eligible with a healthcare card. And a lot of private health insurances will cover a portion of basic dental treatment, like a checkup and a clean, as preventative care.